Hey friends, let's talk about how to feed a newborn a supplement in a bottle to help them go back and forth between breast and bottle. So I'm going to try to demo this for you. There's lots of different ways to do this, but I'm going to give you what my tips and tricks for what I find works the best for two things: for a happy, content baby who is well supported and eating in a great position, as well as helping them go back to breast. So this is obviously not a newborn, and this is obviously not 10 mLs, but I'm going to do my best to show you sort of how we do this. So my first trick, so in bed, I think is easier for a lot of parents, but if they're not in bed, I have them kind of put their feet up on an ottoman if possible, or on the bottom, like if it's the partner doing it, I have them sit so their feet are down on the bench with them. And then I'm going to have them lay a bed pillow on their lap like this. And then we're going to take the baby and we're going to sit their butt up against the belly and lay them on the pillow. And what the pillow does is it provides a lot of body support. So in all babies, but especially babies who are having a hard time coordinating their sex, swallow, breathe, who are leaking, who are choking, who are moving their whole bodies to eat, who kind of can't relax, this will help support their body and help them sort of relax into feeding, which is what we want them to do. So then we're going to make sure their chin is way up off their chest. And the way I explain this is that when you chug a drink, you put your chin up in the air to open up your throat so you can swallow more. You also stay in a nice straight line. It's really hard for any person to swallow with their chin over their shoulder or their chin down on their chest. So we really want their chin up a bit and they're, quite far off their chest. Then we're going to take the bottle and we're going to tickle their upper lip and we're going to let them open and take the bottle. We're going to try to refrain from just shoving the bottle in for two reasons. One is that babies have an innate, drive to open their mouths to latch. Usually, sometimes type babies, it's harder and we have to, adjust the plan. You can force a bottle nipple into a baby's mouth. You cannot force a breast nipple into a baby's mouth. So if we train a baby to stop opening wide, when we're trying to get them back to breast, they don't open wide anymore. And then you're trying to fish a breast nipple into a tiny little mouth. So with the bottle, we can help encourage breastfeeding skills. So we're going to tickle the upper lip. We're going to wait for them to open. We're going to aim that bottle nipple sort of towards the palate a little bit. And we're going to keep it quite parallel to the floor. So what we want is for the nipple to have about 3/4 of the way, like to be about 3/4 of the way filled with milk. So we want it over the top of the nipple, the tip of the nipple, but not fill the whole nipple. We do not want to feed babies like this. We basically waterboard babies like this, and it leads to all kinds of problems. So we're going to keep it pretty parallel to the floor, and we're going to let the baby control the rate of the flow. If you have a baby who forgets to breathe, we're going to have to do some paced feeding where we kind of pull the milk away or tip that bottle back down to let them take breaks again. But a lot of babies will pace themselves. Take a look at the baby in front of you and decide what you need to do about that baby. So we're going to let them sort of do their thing. If it's over an ounce that they're getting, which in the hospital is usually not till day 3, and that's fine. But if they're over an ounce that they're getting, I'd give them a burp halfway through. If it's under an ounce, I probably would just let them take it. At the end, you will have to roll them back a little bit to get all the milk into the nipple, but that's how we responsive feed. I would encourage parents to alternate the sides that they change on, but this is a breastfeeding position for babies. So if we upright pace a baby, there's nothing wrong with upright pacing for a lot of babies. Some babies do great with this. Some babies, you see them swimming, and those babies I would lay back down. But the problem here is what we run into on the flip side when we're getting babies back to breast is babies don't know that laying on their side is how they eat. So you go to lay them down to nurse and they start freaking out because they're used to eating like this. So their body starts to understand when I get into this position, there's food coming. And then we're trying to put them in this position for food, they don't understand. So when we side lie responsive feed them, it's mimicking breastfeeding. There are other ways to position the baby. This is what I find works the best for most parents, both partners and birthing parents. If they have a cesarean, you can just give them an extra pillow to get them up a little bit higher so nothing's sitting on their incision. And then, of course, they can always, they can move them totally away from their bellies if they want to and sort of feed them like this. There are other ways to do it. This is just my preferred way to teach, and it lasts for a good long time. As the babies get a little bigger, we still typically have room to pace feed them this way. Burp breaks, like I said, I do think babies should be burped. Not all babies need to be burped. It does a couple things in those first couple days. It stimulates them, wakes them up, helps them take a little bit more. And occasionally we do have babies who really struggle to get bubbles out, and then they finally get the burp out. All the milk comes out with it. So teach their parents how to do a little burping. They'll figure out down the road if their baby actually needs to be burped or not.